So thank you, Stefan, and thank the organizers for being invited to this stimulating meeting, and I have nothing to disclose. So the Swedish PKU laboratory was founded by Hans Palmstierna and started screening for PKU in 1965. And since 1998, PKU laboratory is one of 4 units at the Center for Inherited Metabolic Diseases, which is a multidisciplinary organization combining clinical medicine, clinical chemistry, and clinical genetics, including specialists in pediatrics, neurology, endocrinology, and bioinformatics. At present, we carry out the newborn screening for approximately 117,000 newborns per year, and we have follow-up of approximately 1,000 patients with PKU and CAH and some other IEMs. Since 1975, we have all our filter papers stored in our biobank, and this has been very, very useful in assuring quality of the screening program and also for making, for example, CMV diagnostics and doing research. So at present, we screen for 25 disorders in Sweden. The 2 endocrine disorders, CAH and CAH, are all referred to a pediatric clinic by pediatric endocrinologists in the laboratory. When it comes to the metabolic disorders, they are all referred to one of 4 specialist pediatric metabolic units in Sweden. And SCID are referred to one of 3 specialist centers for primary immunodeficiencies. We carry out second-tier analysis for CAH, MMA, PA, homocystinuria, IVA, and GA1. And this is to improve precision of our test. And we have approximately 80 to 100 true positive cases per year in our screening program. So the process of implementing new screening disorders in Sweden is a program that is hosted by the Swedish Board of Health and Welfare, and the important decision is made by the Screening Council, consisting of professionals as well as politicians from the different regions in Sweden. First of all, the 24 disorders already in the program was evaluated and got accepted. And then in 2019, SCID was introduced in the program. XALD was evaluated 2020 and was a no, and CF and SMA are now under and ongoing for an evaluation process. So for us, the international collaboration has been extremely important. And when we extended our screening program in 2010 with 90 new disorders, it was very helpful to have help from R4S that later developed into CLEAR. And we have also over the year have a lot of contact with the Nordic countries and some other laboratories and organizations that has been important. I also would like to mention ISNS as a very crucial organization for us and for the Newborn Screening Society. So after the extension of the screening program in 2010 with these 19 new disorders in the program, we realized we needed a registry, and we got funding to start a registry for follow-up of all the inborn errors of metabolism that we were screening for. And that was ready to go live in 2013. So this is a presentation of what the registry looks like, and it has been very useful, and I use it all the time when I see patients because it's ideal to follow things over time. And all the blood Phe values, for example, for the PKU values, are transferred electronically from the PKU laboratory, both to caregivers and patients' families. And we also have a lot of the other patient controls for other IEMs that are directly exported from the laboratory into the registry. And so this is just an example from our annual report for 2020, where we can see all the PKU patients in Sweden that we have in the registry and the blood Phe values that they have. And I think the strength with this is that all the values are actually here and no values are missing, since all the data is exported from the laboratory carrying out the analysis. And with that, I would like to thank you all for your time and for your attention. And I would like to pass on to my colleague and friend, Victor, who will continue.